Castration. Horses, they can live longer and with less injuries when they're gelded. Gelding or castration is a standard practice for male horses that are not being used for breeding. Geldings, they are preferred to stallions because they are calmer and easier to handle. Also, they can enjoy a more natural herd life and have a more social and comfortable existence with other geldings or mares. Castration is a surgical procedure where the testicles are removed. There are different ways, techniques to do it, and this should be discussed with the veterinary surgeon, taking in consideration each individual horse, as there is pros and cons of each technique. In general, the procedure can be done standing or under general anesthetic, also by laparoscopy, or there is also an option of chemical castration, which I'll discuss at the end. Timing of castration. Castration can be performed at any age. The ideal time for castration can depend on many factors, such as the management of the yard or farm, training plans, time of the year, etc. I would recommend waiting until they are at least 6 months old. The most ideal time would be less than a year old, as the size of the testicles is small and there is generally less complications. Many owners will prefer to wait until they become a management problem, generally around 2 or 3 years old. By that age, they will appear more masculine. One thing to consider is that testosterone will affect the growth plates of the bone. And when castration is performed before development, they can grow taller and finer than if the castration is performed, for example, as a 3-year-old. Delaying the castration could increase the risk of the horse becoming more aggressive or difficult to handle. If you have a stallion that you want to castrate later in life, you may be disappointed, as they will retain and remember sexual behavior after the procedure, which can make them great teasers. Once you have decided that castration is the right thing to do, what are the next steps? The first step will be to have the horse assessed. The veterinary surgeon will check that both testicles have descent. Sometimes this will require sedation to relax the horse. Castration will involve removing both testicles. It would be unethical to perform castration and remove only one testicle of a rig. What is a rig? If testicles are not palpable, your horse may be a rig or a cryptorchid. Rig means that they have retained testicles and they will still have a stallion-like behavior. In these cases, castration can be more challenging, and it depends where the testicles are positioned. 1 or 2 testicles could be either in the inguinal canal or the abdominal cavity. To locate the testicle, we can use ultrasound, which at least will rule out the presence of testicle tissue in the inguinal canal. We could also blood test to make sure that we're dealing with a rig. The approach for inguinal castration is easier than an abdominal castration. When testicles are in the inguinal position, surgery must be performed under general anesthetic. When the testicles are intra-abdominal, the procedure will become a major surgery. It could then be performed under general anesthetic by opening the abdomen or by laparoscopy on the standing sedated horse, which is less invasive. Both of these procedures will have added complications. Castration techniques. Pros and cons. The most common technique is the standing technique under sedation. This is generally a very convenient way, especially for younger animals, and also because horses have a very bad design for anesthetics, and it lessens the risks. The main inconveniences are danger to the operator, because horses can kick even under heavy sedation and local anesthetic, and also there is increased risk of bleeding and herniation. Not all the horses can be done in this way. They have to be tall enough for the surgeon to work safely, and this wouldn't be possible in a small pony or miniature. Another way to perform castration would be under general anesthetic. This could be done in the field with a short general anesthetic intravenously, or in hospital conditions where they can have a more safe general anesthetic and more clean environment. The main candidates to do a field general anesthetic castration would be small horses, ponies, miniatures, donkeys, as they have a higher risk of bleeding, and we generally place absorbable sutures. It's important that horses are not very big or heavy, as there is an increased risk of injury in the induction and especially in the recovery from the general anesthetic. I only recommend to perform a field castration and the general anesthetic on horses under 350 kilos. If they are heavier, I would recommend doing it in a more controlled hospital environment. When horses are castrated in a hospital, they can use techniques such as close technique, which will lessen the complications and quicken the recovery. The inconvenience will be the cost. The cheaper cost would be on a standing castration, and the higher cost on a hospital castration. And any general anesthetic also pose a risk, whether it's done in the hospital or in the field. Chemical castration. Chemical castration can be an alternative to surgical castration that may be suitable in certain cases. It involves the use of a vaccine that generally have to be administered 6 monthly against GnRH, a hormone vital in the pathway of sexual stimulation and fertility. The vaccine was originally produced for horses in Australia and is only licensed for mares, although it has been used in stallions as well under no licensed product. In the UK, there are alternative products we can use, such as a pig vaccine, that have similar effect. The effects of the vaccine can be unpredictable, and some stallions may need repeated injections with little effect. There is also a possibility that this vaccine will cause irreversible damage in the fertility of the animal. They also have a high risk of injection site complications and formation of abscesses post-injection. Horses that are competing under rules should not consider this option, as they will be banned from competing. This option may be more suitable for an old stallion with intention to keep him calmer. Common complications. So once castration is performed, there are three main complications: bleeding, eventration or herniation, and infection. Bleeding is an immediate complication. Horses are expected to bleed after this surgery, sometimes for around 10-15 minutes. Bleeding must be minimal and controlled. As a general rule, we must be able to count the drops. Anything more continual or profuse must require immediate veterinary attention. The second complication is eventration or herniation. This is an unfortunate, rare complication that could be prevented if we perform the castration by closed technique under general anesthetic. However, general anesthetic also have risks, and some of them they are higher than the chances of having herniation or eventration. Eventration is the prolapse of tissue through the surgical site. This is an emergency and the horse will require immediate referral. The third complication is infection. Superficial infection is inevitable in open castrations, and is generally the lack of drainage or wounds closing too early that can increase the risk of this complication. Checking for swellings and increased temperature could help us to pick this early. Recovery. Wound healing will occur around 2 weeks after the surgery. The general recommendation immediately post-surgery are to keep horses stable for at least 24 hours. This will allow us to keep a close eye on any possible complications. Following 24 hours, horses can commence light exercise for 7 to 10 days. And after 10 days, they can resume a more normal routine.